It's a great day to talk rehab. I'm Dr. DeFabio, and this is for Dr. Ben, one of my subscribers. So as a subscriber, you have access to me. If you have a question, send me a question. I'll make you a video. I'll answer your question. His question was, how do I test cervical flexion and extension ratios, relative strength, if I don't have one of the biofeedback stabilizers? If you need a biofeedback stabilizer, I get mine from Script, but let me know. We can get you. Chattanooga makes them. They're not that expensive. Mine was $99, but if you need one, let me know. What do we need to do? We need to test cervical flexion versus cervical extension ratios. So first thing you do is relative perceived exertion. So for Greg, curl your chin towards your chest and have him hold it there for 30 seconds. And after 30 seconds, you ask him to grade his RPE, relative perceived exertion, from 0 to 10 and whatever it is. If he starts to shake, if he can't hold it, if he loses his position, he shuts down. If you have one of the little hand exerciser balls, it's a great way to grab that so they go down into flexion and they don't do a chin extension. That will test the deep cervical flexors. It's also the rehab. Relax. You want to do another ratio test. Now this is just flexion. We'll show the extensors and then you figure out the ratio based on relative perceived exertion. If you're using the stabilizer, they do the test of Joule, which we'll demonstrate in another video where it goes under the head. So let's slide all the way off, Greg. Heads off, put them in neutral spine, relax. I want you just right there in neutral spine. I'm going to let go of your head, stay there. I keep him there for, if he can, 30 seconds. And then I ask him to grade his RPE, his relative perceived exertion. If he can't hold it, if he wobbles, if he drops around, the test is done. Flip over onto your stomach. So that's 2 flexion tests. Now what about the extension test? Slide all the way up, chin's off. Let's do a cervical retraction to really engage those extensors, right? Get those locked in, 30 seconds. Let's see how it feels. Relative perceived exertion. You can also do it in, just relax, let your chin drop a little, in neutral spine, all right? If you don't want to engage any of the flexors, just figure out what's going to work best for you. They're all options. Hold it for 30 seconds. What's the relative perceived exertion? The ratio should be pretty close to 1 to 1. The extensors can be slightly stronger. Let's go up into quadruped position. So this is also another way that you can test, but this is a great rehab. These are all rehab as well as testing. Cervical, do retractions, and then drop down. I'm sorry, come out of retraction, and then up into retractions. And then down, and then recover, retract, recover, retract, recover. How many of those can you do in 30 seconds? Cervical retractions is activating the deep cervicals with 12 pounds of resistance, all right? Compare that to how many curl-ups he can do in 30 seconds, all right? Supine, that's another way of doing it. This is also a great test. If you want to start rehabbing him, he can do the flexors and the extensors. The extensors just from quadruped position. Start with a set of 10. Head weighs about 10 to 12 pounds. I think 11 is the average. Then you put him in lateral flexion. He can do it from here. And then he can do his rehab from here. That's all extensor rehab. Flexor rehab, head's hanging over the table, and you have him do the same exercises for flexor rehab. So you can do the exercise as the assessment, and you can use the exercise as the rehab. Pick the ones you like. Do the different variations on your patients, because you may find they can retract, but they can't flex, all right? And they can extend, but they can't retract against gravity. So figure out all those different variables, set up your ratios, and then you know what they need. So Dr. Ben, that's for you. I hope you enjoyed it. And for the other subscribers out there, there goes the ball. Remember, you got access to me. Send me your questions. Please share, like, and subscribe. Have a great day.